professor in athletic training at the University of South Florida. I've been working on research and education related to exertional heat illnesses for quite some time. I'm a Miami native and worked in the secondary school settings, and then been doing research ever since that on exertional heat illness.
What are the top three things that you think all sports or coaches even need to follow or should be aware of as we move into the season so we can have a safe return to sports?
When you're thinking about returning to sport this summer, I think the three most important things to remember, whether it's for athletic trainers, coaches, athletes, and parents, is first and foremost having that pre-participation physical. It's really important that the student athletes go to their physician and have a pre-participation exam to make sure that it is safe for them to return to sport, specifically in the summer and the preseason and those hot summer months. Number two is heat acclimatization. This is something that the athletic trainer as well as the coaches are responsible for, is making sure that the student athletes are doing that gradual progression of exercise in the heat. And that involves limiting the amount of time that they're out there on those first couple of days, the intensity of the exercise, also trying to not exercise at the hottest time of the day. So having practices either really early in the morning or later in the evening or afternoons. And then third, I would just say to make sure you have a plan, having a heat safety protocol, a heat safety plan of how to both prevent it as well as what you would do in case of an exertional heat illness goes a long way. So having that plan and making sure that you're sharing it as an athletic trainer, sharing it with the coaches, and that the athletes know what signs and symptoms to look for.
What do you consider to be the biggest issue or challenge for athletic trainers during this time, and how do you suggest they combat that?
I think the biggest challenge with the return to sport in the preseason, honestly, is going to be the heat and humidity, especially for those of us in SEATA in the Southeast. The heat and humidity, if you've been outside, is really, really intense right now. So I think dealing with that, as well as the pressure to get ready for the season. So the coaches want the players to be ready. They're excited. There were a lot of limitations last year, and I think this year everybody's kind of ready for a new start. And so that excitement and that push to be better and stronger and get out there, combined with the risks of the heat, I think are some of the biggest risks and challenges out there.
What do you suggest they are do to combat that? You said earlier having a plan. So, what would you consider steps they could take to um, get ready for the humidity and the heat, and then for having the plan?
Yeah, I think one of the ways to combat those challenges that you have from exercising the heat, along with having a heat safety plan, is making sure that the coaches understand that it's a gradual progression. You're going to get a lot more and a lot further in the season if the athletes are able to gradually progress, not just to the heat, but to the exercise. It's great if the athletes have been participating in voluntary workouts over the summer and conditioning, but some of them haven't. So I think that gradual progression to exercise and the heat, as well as making sure that they have access to fluids at all time, making sure that somebody, whether it's the athletic trainer, the coach, administrator, is monitoring the environmental conditions, and then using that information that you get from the environmental conditions to modify practices, where that means it's less equipment, shorter duration of activity, less intensity, or even just the same amount of time, but more frequent rest breaks and fluid breaks.
What
Okay.
is one thing that you would stress to coaches specifically when preparing for preseason?
I think one of the things that I would stress with the coaches is, again, to have that gradual progression of exercise and gradual exposure to the heat. Working with your athletic trainer, listening to what your athletic trainer has to say about heat safety is really important. And also knowing your athletes, looking for signs and symptoms of heat stress. If you see that they're kind of out of it, they're just somebody that is usually working really hard, is kind of sluggish on one day and not kind of responding the way they normally do, that's definitely a warning sign that that athlete probably needs a break, needs to go into a cooler environment and get some fluids in them.
So, kind of piggybacking on that, what is something you would suggest to parents or guardians to watch for their athletes to encourage a safe sports return?
Yeah, when it comes to heat safety, it's really a team approach. So it's really important for parents and guardians to be aware of the signs and symptoms of heat illness, and also making sure that their child is sleeping enough at night, getting a full night's sleep, making sure that they're having nutritious diet as well as replacing their fluids. Um, Also monitoring their body weight before and after practices to make sure that if they did lose a lot of water weight during activity, that they're able to replace that fluid that evening before the next day's practice. And then kind of monitoring for anything that seems unusual. They are going to be tired. That would be normal, especially if they haven't been doing much throughout the summer, but kind of just monitoring them, making sure if they have anything like headache, vomiting, any other warning signs, something that is not a normal behavior for them, to make sure that you are monitoring them, have them evaluated by a healthcare provider, and make sure that it's safe for them to return to practice the next day.
Okay, last question.
Okay.
Could you give us three things, or however many you think,
Mhm.
that AT should remember as we start, and what pearls of wisdom do you see as necessary, maybe even in response to exertional heat illness?
Yeah, pearls of wisdom for heat safety for an athletic trainer. Most importantly, be prepared. I think the key here for heat safety is to know how to prevent it. So take whatever steps you can for prevention, whether it's heat acclimatization, making sure they have access to fluids, making sure the athletes are cleared before they step on the field. All those things for prevention are really important. Educating the coaches and educating the athletes and parents about heat safety is really important. On the flip side, be prepared for when a heat illness does happen. As much as we would like to prevent every single heat illness, it's not possible to do that every time. So being aware of the signs and symptoms of heat stress, of the heat illnesses, and being ready to treat it. When it comes to exertional heat stroke, it's really important to remember the two main diagnostic criteria are rectal temp greater than 105 and central nervous system dysfunction. So if you have a patient, an athlete that collapses on the field, you want to get a temp, make sure it is exertional heat stroke, along with looking for signs of CNS dysfunction. And then you want to be prepared because the gold standard of treatment for exertional heat stroke is to cool them via cold water immersion on site before transport. So you want to cool first, transport second, but you don't want to delay transport to the hospital if you don't know that it's a heat stroke for sure. So you want to make sure that you're absolutely sure on that diagnosis with a temperature reading and the CNS dysfunction, cooling them on site with cold water immersion, and also calling EMS. Because even if you do cool them on site, you absolutely want to transport to the emergency department. Those are the keys there. Have a written heat stress protocol, share it with your coaches, share it with your athletes, make sure everybody is on the same page as far as how you're going to handle a heat illness emergency such as exertional heat stroke.